So I was super excited to be able to talk to you all today, and I'm so happy we're having this conversation. And I was also so surprised to hear everybody talk about imposter syndrome, because I thought that was just going to be me today. And in fact, on my Instagram story this morning, it was hashtag imposter syndrome is real. So I was very surprised to hear everybody talk about that. So at the University of Michigan, well, let me start by saying this. One of the things that we do in nursing is we eat our young. Has anybody heard that phrase before? Yeah, so it's not common in all of healthcare, but apparently, I'm sure everybody does it, but in nursing we talk about it all the time. So I was thinking imposter syndrome. I'm here in this building as a nurse, as an academic, talking to a bunch of clinicians where I see patients also, but I'm definitely not a hospitalist. I don't do internal medicine. I work in a homeless shelter. So I have, a lot of feelings of imposter syndrome. At the University of Michigan, where I teach, we, within the last 5 years, had a big overturn of a new president, new provosts. We had 9 out of 15 new deans, all within a very short period of time. So what that meant for us was the time was right for change. So we pride ourselves, so if any fellow Wolverines in the room, we want to be the leaders and the best. So we wanted to see what we could do in terms of really moving forward in terms of diversity, equity, and inclusion. So our new president, who is also a physician, as a matter of fact, was very open about what his agenda was. And his administration said that what they wanted to do was create an academic environment and a community where we welcomed everybody and we celebrated differences, and we used those differences to really create a community and a sense of well-being and inclusion where everybody felt like they could be involved in whatever they wanted to. Then we wanted to say that we recognize the value in that, and we're doing that in order to advance our collective capabilities. So we wanted to leverage that. When, like any good leader, when President Schussel came in, he took focus groups of the university, and he took surveys, and he asked, what does it mean to you to have a positive workplace climate? And so this is what came out. So we want to be respected. We want to feel valued. We want to be included. We also want to have fun. We don't want to hate going to work. So when they looked at more of the data, they found that 70% of people actually said that they felt that they had a sense of belonging, they felt valued, they felt respected, but lowered 51% felt that they belonged. And that was even lower in the School of Nursing. We were at 44% feeling like we belonged or felt included, and that was very similar in all of the health sciences as well. So we kind of took a three-pronged approach to this. And anybody who knows me knows I love food, so I'm always going to be talking about food or using some sort of image about food. I like to eat. So we have a systems-based or a larger top-down approach. We try to bring in some change at the classroom level and then also at the individual level. So I'm going to be talking about kind of each of these. So like I mentioned, the president had a directive, and his administration was very, very open about this. He appointed a provost that his entire job, Robert Sellers, his entire job is looking at diversity, equity, and inclusion across the university and trying to bring that into the classroom. So there are different initiatives that are being brought in. So I serve on one of the faculty committees, so we can talk about what it would mean to have an inclusive classroom and what do faculty need. Because in healthcare in particular, we kind of think that we do it, or we say, well, we have to take care of everybody, so we clearly are good at this when we're really bad, actually. So what kind of resources do our faculty need? So at the university level, the president put his money where his mouth was, and he gave every school and unit money. So money to hire diversity officers, which Rashika Patel is our diversity officer, and she's amazing. She's an anthropologist, so she brings a whole different perspective. And then they get an annual budget. So our school is able to have money every single year to spend on initiatives that will help further diversity, equity, and inclusion within our unit in particular. There are steering groups. We have different educational events. There are lots of things that happen. At the school level, because The president is a physician. I think this was very helpful. He recognized that burnout is a huge problem. So we're one of only 11 units on campus where we actually have a counselor who is on staff at the school. So that person is there able to do individual counseling sessions for our students. She does very kind of unique programs. We have something called Therapause where we have dogs that come in and people can just relax and play with dogs in school. It's kind of unique. We have facilitated conversations in what we call our brave spaces. Those are usually student-driven as well. So that's another thing that we do. Then moving into the classroom and the clinical setting, this is where things get a little bit dicier. So it's hard to actually control what happens in the clinical setting, right? So we don't control who comes in the door. We don't control what patients we see, but we need to move away from eating our young and actually try to teach in a way that our students can understand and feel that they can ask questions, that they can not know the answer. One of the things that we talk about is having clear expectations and rules. I joked around about it at my table at lunch is I kind of treat my students like I treat my 8-year-old twins or my psych patients, where I'm just very open. Like, these are our expectations. I'm consistent with following those rules. There are outcomes. There are things that happen if you don't follow the rules or you don't live up to those. Like, we treat each other with respect and just being transparent in all of that, knowing that the students, it's okay to disagree with me in class. It's okay to challenge me. I clearly don't know all of the answers. So we try to role model that behavior in class as well. We have teacher workshops and student workshops on how to do communication and how to work within the clinical environment and how to navigate when there are patient lives involved. And then in the interpersonal aspect, this is where we have the most fun. So we have something called M Healthy, which is funded by the university, and we have nutrition classes, we have physical activity type things that we do. There's counseling. We try to allow the students to facilitate things as well. This Love Yourself event was brought up by the students where they wrote love letters to themselves and then also to other people in the community as a way to create empowerment and be able to facilitate conversations between themselves. We also try to lead by example. And I think that that's something that we're talking a lot about today too, but in real life, we need to try to move to that. In real life, we don't talk about it as much. We'll be starting a fellowship in July in hospice and palliative medicine. And one of the things that struck me when I was interviewing was I was asked by every single person who interviewed me, and there were like 9 of them, what do I do for self-care? What kind of things do I do to make sure that I'm healthy and that I am not going to take this heavy subspecialty home with me, and how am I going to stay the best person that I can be so I can treat my patients well also. Then in the future, things we're thinking about adding, we're looking at adding Mindful Mondays. This was something that a student requested, where we have facilitated conversations and we do group meditation, and our counselor is going to be involved with this as well. We're hoping to do some events for some communities, but ultimately what we want to do, our elevator pitch, if you will, what we talk about all the time, is we want to increase diversity, we want to increase our sense of well-being, create good habits, kind of like preventive, primary prevention, I guess, if you will, for burnout. And then we want to create communities of practice where our students feel like a sense of belonging, and then they can move to that in clinical practice too. And our dean always says that, you can have all the strategic plans that you want, but that culture eats strategy for breakfast. So what it takes is one person doing small things to create big changes.
Great. Thank you, April. Lemora.